The purpose of our initiative is to provide knowledge and resources to caregivers, family, friends, and anybody who is dealing with someone who has mental illness. We also are aiming to reduce stigma, and by doing that, we hope that when people need help, they'll feel free to come forward and get help. Let's talk about Dana Carroll. Dana is our speaker today, and we're really pleased to have her. She's the Mid-Atlantic Territory Manager for Red Oak Recovery. And I have to give Dana some extra props here today. When we first started talking about a mental health initiative here and what we wanted to do, Dana was the very first person that I met with. And she said, why don't you have a presentation once a month and have a mental health professional come and speak? So she is very much responsible for this mission and the success of it, and we thank you for that. But she's going to talk to us today about the various levels of care for mental health. So let's welcome Dana.
I had the pleasure and the opportunity to connect with Robin. We were just kind of chatting on the side. It's been well over a year ago. When we first connected, I was working at, I think, Newport Healthcare. Then I had transitioned to Family First Adolescent Services, which you'll see was what I had prepared my slides under. And now I come to you, and I'm from Red Oak Recovery, which offers adult and adolescent services in the Asheville area. A little bit to kind of share about me before we get started is I'm a mom of two, what we call now emerging adults. So 2 emerging adults, not 2 children. I love this generation. They have new names for everything. And about 8 years ago, our family started in the need for mental health and recovery care. And I struggled because it was something that I needed for my family and for an adolescent, and it was really hard to find those services. So I'm very blessed that as I come to you today, part of my career is to help families navigate levels of care. So I'm very thankful that I have the opportunity to talk about something that's near and dear to my heart and to share with you all about levels of care. Before we get started into private insurance, there's 2 things you'll see as I go through my presentation I'm going to talk about a little differently, is that levels of care also vary on what type of insurance you have. Levels of care look different for those that have private insurance and those that have Medicaid. And that is because private insurance covers certain levels of care that Medicaid does not. Medicaid offers certain levels of care that private insurance does not. Sometimes, if you're in one insurance bucket or the other, you can privately pay for the level of care that is offered under Medicaid or private insurance. Sometimes you cannot. So I'll just kind of put that out there as well. So what really is the first level of care? Most of us think of outpatient care, right? Going and talking on the couch, talking to a therapist, talking to someone for medication management, going to maybe connecting to the crisis intervention if the police are involved. Perhaps when you talk to your physician and you go to them and say, you're not feeling your best, how can they help you? Maybe you've heard of behavioral health urgent care. There are some new options now that you can go versus just the quote traditional emergency room. There's behavioral health urgent cares that you can go to. And then there's also inpatient stabilization. So these are first levels of care that you will find that levels of care in mental health isn't a linear motion. Sometimes when you're in crisis, your first intervention might be the behavioral health urgent care. Sometimes you might be well enough that your first intervention is just talking to a therapist. Sometimes someone might have a need out in the community that the police or a crisis intervention trained officer comes to help you. So you may enter into mental health and or recovery care at kind of a different level already at your first level of care that is needed. So we'll talk about outpatient. As I kind of mentioned, one of the key first levels of care is outpatient, right? For some people, for adults, it's talking one-to-one. For children, it may be play therapy. It might be the parents are going separately and kind of involved in that. It might be a group therapy. Maybe you go and you do group therapy work versus it just being you yourself. Or it might be connecting with a psychologist for an assessment to see, maybe they'll do some testing, or maybe they'll do some additional therapeutic clinical work to see what types of therapy might work best for you and or for your family. So as you can see, outpatient therapy could be just traditional, could be couples therapy, could be family therapy. There's a lot of different opportunities in terms of the traditional outpatient therapy that we think of. Then if you're looking at it on the Medicaid side, they also have what is called intensive in-home therapy. So one of the buckets on the Medicaid side is where the therapist will come into the home. Typically, there's two separate therapists, one that will work with the parents and one that will work with the child separately, and they do that work in the home so that they can see how the relationship is happening within the home and help to guide both the child and the parent separately and then collectively to start that healing process. There's also some other options that is considered experiential therapy. And so this is an expansion from just sitting and listening and processing to more doing. Right? And so typically experiential therapy is done in a group, usually a milieu size, anywhere from 6 to maybe 12. 12 might be pushing it. And they do different things like equine therapy, spending time with the horses, learning how to relate to another being other than yourself and caring for someone other than yourself. Yoga. There's a lot of trauma-informed yoga, yoga that works to kind of help pushes forward a little bit more with some of those body feelings that you have, to kind of push through some of that trauma, to kind of let some of that go. Likewise, art therapy can be working with many different modalities. The texture feel of art for many trauma, for some folks that are autistic on the spectrum, do really well in art therapy where they might work with clay, they might work with cloth, they might work with all different types of textures that instead of just sitting and not being able to communicate and feeling overly stressed for that, in that time of working, doing the artwork, they can still be having a process session where the individual is focused more on the art and less on the communication, but yet the communication is flowing much more freely and there's less anxiety and intensity in the sessions. Likewise, music is another experiential group therapy, whether it's playing an instrument, whether it's listening to music, various different things like that. We have found that in the industry, a lot of this younger generation really does well in creating their own music. They like to create their own raps, their own beats, their own songs. It's really a good way for them to get out their feelings or trauma and talk about different things without actually just sitting in that one-to-one face-to-face. And then one of the other experientials is adventure-based. So some of the residential care programs and or some of the other programs that go group outings on the weekends. So they might go and they might do a hike and you think, well, how is a hike therapy, right? So it's working as that group. Maybe someone has to carry the water. Maybe someone has to carry the tent, right? They have to communicate with each other. The first person leading about a tree branch. How do they hold that so it doesn't hit everyone else in the face that's coming through? It's really about a way of getting that communication and that relationship to build and to focus with each other. That those are skills that they can use safely within that group. And then they can take those same skills back out into the real world and use those skills in their other relationships, whether it's with their parents, whether it's with their spouses, whether it's at work, whether it's at school, peer-to-peer, all of those different types of things. I think one of the things that often gets missed in life is that when we have children, and I have several nieces right now going through this with newborns and little ones, we focus so much on that development and growth and milestones in newborns and babies, right? We forget that our teenagers have developmental milestones as well, those teenagers and those young adults. And that's relationships. And where do those teens learn about relationships? They learn about them from the home. They learn about that from the family and the relationships that they have already. And so remember, as parents, this is our first time parenting too. This is our first time trying to navigate what those relationships look like with our children when they go from little to adolescence and to young adults. And how do we talk with them or have a healthy relationship with them in a new way? So these adolescents and young adults are taking the relationship from home and trying to place that out into the world and then learn how do they relate with other people. And of course, Robin has done really well to have other people talk about those types of things and the impact that the new social media and all those types of things have on these young people and those relationships. So this experiential group therapy is really helpful to show this younger generation and even adults how to have safe, healthy communication in your relationships, whatever that relationship might be like. Because after all, as humans, we don't survive in a vacuum. We need a community. We need community, such as welcoming wellness, whether it's the church, all of those types of things to help us thrive in our life. Intensive outpatient. So we talked about outpatient therapy. We talked a little bit about how that can look in terms of individuals, couples, families, groups. Now we're going to go up a level on level of care, and that's called, we in the industry refer to it as IOP, but it's intensive outpatient. So it can look like 3 to 4 times a week, 3 to 4 hours a session, and those sessions typically last anywhere from 10 to 12 weeks. Most places do it in which people may come and go from the group. Typically, if you're in a community setting, such as where we are here in Cary, there's a few places that offer IOP. And so they allow someone to come in this week and someone might start in the next couple weeks, and they allow them to kind of filter in. Because it's harder in those group settings to start everyone at the group at the same time and continue through together. But you would see more of that in a residential setting where the group remains the same. Typically, some of those intensive outpatient groups are either based upon age, can be based upon gender, and sometimes can be focused on, you might hear of what's called an SA IOP. So it used to be substance abuse. Now we know it as substance use. So sometimes they're just mental health or substance, or they might be combined. The other thing that we have is called a PHP program, a partial hospitalization program. So think of it again, you come in at the outpatient level, then you have intensive outpatient, and then the next level up from that is called a PHP, a partial hospitalization program. So you're not going necessarily to the hospital, but you're doing programming for the bulk of your day, like a 5 to 6 hours of your day is spent doing programming, and typically that can be done 5 to 6 days a week. Sometimes it's Monday through Friday. Sometimes they'll have a day off during the week and do one day on the weekend to kind of give you, some of that might include that adventure base that I talked about earlier, or just to give that opportunity to not have 2 days at home without that therapeutic touch. That level of care, the length of time is usually a little less than the intensive outpatient. Intensive outpatient, as I mentioned, can be 10 to 12 weeks. PHP can be more like 2 to 6 weeks. It's really about trying to get connected with the person to help them de-escalate and to help them stabilize, which is a step down then from being hospitalized, but yet is a step up from the intensive outpatient. Residential care. So residential care is typically 30 days minimum can be up to 45 days, 60 or 90 days. It is not a hospital. A lot of folks think that residential care is hospitalization. Those are different. Residential care is based more on being in a home-like setting. So typically it is not locked. The person may leave. They have to willingly want to attend and participate in that programming. They do stay there overnight. For adolescents or young adults, they may do schooling, or they may do some level of college work or college prep. There typically is medication management while they're there. They see a nurse while they're there. They have an assessment while they're there. If they land there and they haven't had any type of psychological assessment up to this point, I really encourage a complete assessment to see what's going on with the individual. There's individual therapy, there's group therapy, there's adventure-based therapy. So kind of think of it as though you've gone to that PHP level that was just before, that you were going and you were doing 5 to 6 days a week, but going home at night. And that's not working. Maybe you need some time away from that home structure, which oftentimes can have many of the triggers, whether it's person, place, or things. And so being in that residential care, you're really taking that time to focus on yourself, your mental health, and or recovery needs in a secure environment. One of the big things that I'm often asked, because I help a lot of families with adolescents into recovery, is, do they have to want to come? Right? I'm going to chuckle a little, right? Because I always say to the families that I work with, okay, if you give an adolescent 3 choices, stay home, go to care, go to Disney or vacation. In all of the time I've done this, which has been about 7 years, I've only ever had 3 teenagers say to me, I need and I want to go to care, right? Because at that age, there's so much stigma, there's so many other things going on. But the key is there has to be this internal willingness to want to become better, to know or understand that there's a need for a change, and to come and to engage in that. If that individual, whatever the age, is willing to come and do the work on themselves, then the outcomes tend to be well for them. Therapeutic wilderness. Many of you may have heard it through Paris Hilton, and that's why I say a sensitive topic in today's world. Paris Hilton has come out with some guidelines that the last administration has approved on looking at residential and therapeutic wilderness levels of care. This modality has been very popular over the years. It started back in the, I'm going to say, late 60s, early 70s. A little bit more of the touch of kind of Wild West, if you will. Having clinicians, taking them out into the woods, getting them the opportunity to feel, to understand themselves. Over the years, there's been a lot of involvement on the therapeutic wilderness programs of having more of a clinical focus, being more structured, becoming credentialed, being in different groups so that they are focused on safety and security of both client, adolescent, and young adult in the field, as well as the staff. Having more of a medication oversight with a director, a clinical director, and also a medical director. Therapeutic wilderness can be really helpful for those who, as I mentioned to you in the residential side, are that I'm not really sure I'm buying into all this, but might have a little bit of a higher acuity or an uptick to harm themselves or to harm someone else, but really might not require that hospitalization or stabilization. So in these settings, it's typically 45 days or longer. There's a couple different options that they're either in a cabin or nomad, where they're in the woods and then come back to the cabin once or twice a week. They work, as I mentioned, with a clinical director. The clinicians come into the field to do therapy with them. Likewise, they see a nurse for medication management. There's a psychiatrist that sees them. There's a lot more on that adventure-based, experiential base of the feeling, The concept for many folks that have had a trauma past in the therapeutic wilderness program is the openness, right? Think of the times when you go to therapy and it is perhaps in a smaller room or it is in that group setting. And for some people dealing with some of that trauma, it's harder to express or release some of that. Whereas being out in nature is very freeing, is very safe, is very comforting. So that is why that as an opportunity has been another modality that's been used. Therapeutic wilderness typically is not covered by either insurance, not typically by Medicaid and not typically by private insurance. Sometimes some of the therapeutic sessions done in the field can be compensated through insurance. Now, having said all that I just said, there are times in which the juvenile justice system will connect and will place adolescents and young adults into some therapeutic wilderness programs because these have shown to be very effective to help as a diversion from the traditional justice system. So that is something that is done as well. And then the top level of care, so just to kind of go back and think, okay, where are we? We started outpatient, we've done intensive outpatient, we've done partial hospitalization, we've talked about residential level of care, we've come over to that wilderness therapeutic program. Now we're going to talk about psychiatric residential treatment. This is the highest level of care. But what is also interesting is, for some people, this can be their first touch or the first level of care that they ever have in mental health or recovery care. And that is because of different cues or feelings or thoughts along the way. They haven't been able to engage in regular outpatient level of care that we think of. They have a crisis. They're out in the community and something happens. And so the ambulance is called or police are called, or something happens at home where they're of a harm to themselves or they're a harm to someone that's in the home. And so how does that look? What is that care like? Typically, these psychiatric residential treatment facilities can be more of a locked setting. So the person is restrained to being in that area. And this comes after the stabilization that they might have in a psych unit. So there are some times when an individual goes right into the hospital and the psych unit in the hospital or behavioral health hospital, and they haven't stabilized enough to not want to harm themselves, to have suicidal ideation or homicidal ideation towards others, that they have to remain in that locked facility or that locked unit. As a whole, the industry really has tried to get away from utilizing these facilities, but they still exist because there still are folks who need that level of care. So they're having individual therapy, they're having group therapy, they're staying there, they're having their medication management, and then the hope is to kind of drop them down to a different level of care. This is oftentimes on the Medicaid side, what Medicaid allows for versus a residential level of care that I mentioned earlier. A lot of it really is in the payment codings and how that terminology is used from the insurance side of paying for care. Another level of care that we think of is detoxification. Years ago, there weren't a lot of standalone detox facilities in the communities. If someone was overdosing on substances or too much alcohol, used to be just go to the emergency room. Now there are some standalone units that offer detox. Typically, that's 3 to 5 days. Really, the detox protocol depends on what substances the individual's been using. So they definitely do some blood testing to see what the individual has been using to determine what that protocol looks like. And Typically less than 10 to 14 days. 14 days length of stay would really be based upon someone having perhaps some more physical complexity that they're experiencing in addition to the need for detox, because some of the facilities that I mentioned to you before, whether it's residential level of care or the PRTF, they need to see that the person is detoxed before they come to that level of care. So it makes everything very interesting. So inpatient stabilization. I kind of misspoke earlier when I said PRTF's high level of care. Inpatient stabilization really is the highest level of care. However, a lot of folks think that when you go for inpatient stabilization, you're going for therapy. Typically, there's not much therapy, or there's not much of a therapeutic intervention when you're at inpatient stabilization. The concept for inpatient stabilization is to make sure that the patient that is there is safe of self. Typically, these folks have had a suicide attempt or have had homicidal thoughts towards someone else. And the concept to be in this inpatient stabilization, typically they're not able to wear their own clothes. They're very restrictive on what items or tools they can have with them. Anything from not being able to have personal care items, really monitored on what they have to eat with. The items that are in the room with them, it's very purposeful and mindful that the chairs, like, I know you at home can't see this, but we're just in like a traditional chair here. The chairs in an inpatient stabilization unit are weighted so that they can't be picked up and tossed. Same for the tables, they can't be moved. So the concept in these units is that anything that is the patient is able to touch or be with can't be used as an object of harm to self or to someone else. And so really what that's about is 15-minute checks. That's a lot of eyes on the patient to make sure that they're safe and everyone in the milieu is safe. So therefore, because of that, there is not a lot of time set aside for one-to-one therapy, and there's not time set along for group therapy, because typically in the inpatient settings, there is such a wide variety of diagnosis and needs. And at that level of care, the concept is really just making sure that the person is safe of self. And I hear that a lot. We are fortunate that in our community, in the Triangle area, we have Triangle Springs that offers adult stabilization. They also offer adult detox. We have Raleigh Oaks, which I know they had a presenter here on your program previously, so they offer that inpatient stabilization as well. And then for children and adolescents, we have the Holly Hill Hospital, and they also offer that for adults as well. That is what this type and this level of care is for. And then likewise, on the detox side, Raleigh Oaks can do some detox, and New Waters in Raleigh does detox as well. There are some hospitals in the area. For example, UNC offers adolescent and adult care so that you could go there for stabilization. And likewise, I know that you had Michelle Kasner from Kids Peace in the Fuquay area. They offer the behavioral health urgent care and the 23-hour watch, and now they have a wing for adolescents for inpatient stabilization. So these really are some resources that we can have in the community versus just going to an emergency room, whereas if the family is in crisis and you go to emergency room, the individual may get a room, may wait in a hall, but really isn't a lot of intervention until they get then transferred to one of these facilities that's able to provide that care. So navigating care, right? You know, this is the other part that's interesting is not every community has all of these resources. And it's not always linear. It's not always that, as I mentioned earlier, not everyone starts at the lowest level of outpatient care. Some people start at crisis intervention inpatient. Some people start at detox. Some people start at group therapy. You know, how do we get to the care that is needed? How do we find resources? You know, myself, I'm an individual. I've been very fortunate that throughout my career, I've worked at different locations that allow me the opportunity to connect with anyone in my community. And it doesn't mean that in connecting with me, your loved one is coming to the program that I represent. I've been in this field 8 years. I've connected with adult recovery, adult mental health, adolescent. The key is really trying to make the appropriate match for the client's needs to the services that are offered, and not just saying, okay, yeah, we know a place, let's go. Because not every place offers that level of care, and not every group that's there is also appropriate for your loved one. The other thing that's really important when we talk about levels of care is, so we were kind of talking and we said, okay, inpatients here, outpatients there, you know, how does level of care work? What we call is aftercare, right? So what does it look like if you're inpatient stabilization? Are you able to go to residential care? Most likely, yes. Can you afford that care? Where is it available? If not, can you try partial hospitalization that's in your community? Or maybe the next step down is intensive outpatient. The other part that's so important for aftercare and working is what's family care look like? So you've had someone that's been going through traumatic experience, whether it's recovery, whether it's mental health. What are the supports available to the family? I know that you've had 180 was here and talked about a family counselor, right? What's family therapy like? What's individual therapy like for the parents or for the siblings, right? How can we have everyone remain connected during care, and what does that aftercare look like for a duration? What I have found, both personally and professionally, is it's a duration. It's a lifestyle change, and it's a lifestyle change for the whole family. One of the other things we were just kind of talking as a sidebar earlier is looking at what are those costs of care? What type of insurance do you have? Can you use your in-network benefits? Are you utilizing out-of-network benefits? If you start on one side of it, stay on one side of it versus trying to meet two deductibles, right? So that's really something in navigating levels of care that I really try to talk to with folks when I'm helping them get the care and the services that they need, right? Maintaining with medication management. All of those things are so important when you look at the levels of care and how a family can heal together. The other thing that's really important that we talk about are support groups, much like this one here. Many of the folks that are out in the community connect, I recommend NAMI to a lot of folks. NAMI has a lot of resources in the mental health realm that can help both as a group, can also help individually. Alcoholics Anonymous, Narcotics Anonymous are another great thing for those that are in recovery. Definitely here, such as this group, Welcoming Wellness is great. SAMHSA is on the website. That's another group that's a nationwide program that you can go on and you can look at different programs that are vetted, that have different resources available. One of the things that I really encourage to folks is that this journey, this process can be very isolating. We take on a lot of shame and a lot of guilt as parents when things happen to our children, because that's not the journey, that's not the life, that's not the family that we saw for our loved one. And so it can become very isolating. It can become very shameful. What I learned in this process is that there were more people like me. Oh, see, I can't touch my microphones. There were more people like me suffering than non-suffering, but I didn't speak out about it. Another good support group and another good resource in our community is alternative schools. Our Raleigh area is very lucky to have Wake Monarch Academy, that is a recovery high school. Likewise, Fusion Academy is a school that offers one-to-one schooling for individuals that a classroom is overwhelming for. So over the last 8 years, I've seen so much growth in our industry that makes me really happy that there are resources for parents such as this, that Robin has created, such as NAMI, these other schools, these other opportunities. I think that we talk and we hear so much about stigma in mental health. I would like to think that stigma in mental health will go away. I don't know if that will ever happen. I think that we've seen a lot of things become more normal or commonplace with our young folks, failure to launch and some of those other things. And then we as parents think, well, if that's happening to everyone else's child, my child's okay too. But we know that in a community, we need each other and we can heal and we can grow and be better together. And that being okay with sharing our stories and our journeys, much at these events, we can heal and become well together. So thank you.
Thank you, Dana. That was a very informative presentation. Wonderful. Thank you so much. And thank you to all of you who've joined us in person and by Zoom today. Our next session will be on February 9th, and it'll be presented by Chris Ford. Chris is an expert in grief counseling, and she's going to talk about how grief affects long-term mental health, particularly in teenagers and young adults, but in everybody. So I think that's going to be a wonderful session, and I hope you'll join us for that. If you want more information about that, you can go to the events page on our website, which is welcomingwellnessnc.com, and read a little bit more about Chris and her qualifications. Also on our website, you can sign up to get a Zoom link. And those of you who are on Zoom today, we have added you to our future Zoom links so that you will get those for all of our presentations. And our presentations are free, but there is a Donate Now button on the website. So if you would like to donate, we would be happy to accept your donation if you have found value in what we're offering. Thank you for attending, and we hope to see you on February 9th. Good afternoon.